Hello, my name is Sarah Peters. I'm a nursing student at Indiana State University, and today my health education is about how to manage your diabetes. My PAR is Hispanic diabetics. However, since I cannot do the presentation in Spanish, my goal would be to make this presentation into Spanish with the help of translators from my facility, and I would show this to the Spanish population to help them understand their diabetes a little bit better. Today, some of the learning objectives that I would like to touch on would be what is diabetes, how you are diagnosed with the disease, if you are diagnosed with it, how to successfully use a glucometer, how to have a healthy diet and successfully carb count, how to administer insulin from a vial and from a preloaded pen. I would also like to touch on some oral medications quickly. I would also like to discuss referrals that your doctor may give you if you are diagnosed with this, and some support groups that would help people that are diagnosed with this disease. At this time, I would like for you to stop the presentation and do the pre-test that I have included with this. Thank you. According to Oxford, diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, thus resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and the urine. Once you have the diagnosis of diabetes, you will keep the diagnosis for the rest of your life. However, with diet and proper medication regimen, the disease is totally manageable. When your doctor is trying to determine the diagnosis for diabetes, they will ask you if you have had any symptoms. Some of these can include increased urination, increased thirst, wounds that are slow to heal, and if you have been having any numbness or tingling in your hands and or feet. To make a diagnosis, the doctor will take some blood and they will do a couple of tests. One of the tests is called a hemoglobin A1C. This determines your blood sugar average over the past 2 to 3 months. Over here to the right, you can see that I have attached the A1C value, which on the left shows the A1C value, and on the right, what that value would correspond with, the average blood glucose. The blood test must be done 2 separate ways to make a confirmatory diagnosis for diabetes. As you can see, I have attached the different tests that can be done and how they can be done. Once the diagnosis has been made, your provider will want you to start checking your glucose levels at home. As you can see, I have attached a picture of a blood glucose monitor. When checking your glucose, you will need to make sure you have the proper tools. These include the blood glucose meter, the test strips that are made for your meter, lancets, alcohol swabs or a bottle of alcohol and some cotton, Band-Aid if you need it, and a sharps container. Typically, no matter how many times a day that you check your blood sugar, you will check it first thing in the morning before you eat. You will gather all of your supplies needed and you can sit at a table or wherever you feel comfortable. You will turn your monitor on, place your test strip into the monitor, clean your finger with the alcohol prep pad or cotton ball with alcohol, prick your finger with your lancet. You will wipe the first drop of blood off with a clean cotton ball, as the alcohol that is left on your finger can make your blood glucose level read higher than what it is. Place the second drop of blood on the test strip. Place the lancet and test strip once the reading has been made into your sharps container, and you will document these readings on your blood glucose log for your see at the next visit. As you can see, I have attached a blood glucose log. This is just an example of one that you may use to keep track for your provider. Along with checking your blood glucose, having a healthy, balanced diet is key to diabetes. The USDA has provided us with a healthy eating plate, and they recommend that half of your plate be filled with fruits and vegetables. The grain I'd like for you to have would be whole grain. As a diabetic, learning what to eat can be tricky. However, they need to avoid carbs as much as possible. Some good superfoods for diabetics include beans, dark leafy vegetables, citrus fruits, fish, nuts, whole grains, and dairy. Also, you can see I have attached some examples of each of these. Also, carb counting, while essential for type 1 diabetics, is a great tool for type 2. Not only does it help lower your blood sugar, it can also help with weight loss, which can in turn help lower your blood glucose. I have attached a nutrition label, and I have a couple of different arrows pointing to the different things on how to learn how to read these. You can be started on oral medications. I have attached and this page the different oral medications, their brand names, and what they do. If diet and oral medications are not enough, your provider may put you on an injectable insulin. According to Oxford, insulin is a hormone produced in the pancreas by the islets of Langerhans, and which regulate the amount of glucose in the blood. On this page and on I have attached some of the injectable insulins. I have put their onset time, their peak time, and their duration of how long it would last. While injecting medicines can seem a little intimidating, properly learning how to use these can really help with some of the apprehension. For both insulin pens and vials, the required supplies include the insulin vial or pen, the insulin syringe if you have a vial, or the pen needle if you have a pen, alcohol swab or alcohol in a cotton ball, and a sharp. For the insulin pens, you're going to take off the cap that exposes the needle holder. You will take your pen needle and screw the needle on. Dial up the amount of insulin needed. The dial is on the opposite end of the pen from where the needle will be. There's a little window that will tell you how much insulin you are drawing up. You should choose your site. Your site could be around your belly button, on your upper thighs. It can be on the backs of your arms, however, that is a little hard to reach. If you do use your belly, make sure you are at least 1 inch from your belly button. Cleanse with alcohol. Place the pen needle into the skin. Hold the injector button, which is on the same end as the dial, and you will push it until the display shows 0. You will remove the pen from the skin and place it in the sharps container. For insulin vials, you will clean the top of the vial with alcohol. You will place the needle into the vial, draw up your recommended dose, choose your site, as we discussed before. You will cleanse with alcohol, place the needle into the skin, push the plunger to inject the insulin into the skin, remove the needle, and place the needle with the used syringe in a sharps container. Once you are diagnosed with diabetes, your doctor will make some additional referrals. They will want you to see podiatry for diabetic foot care, just to make sure that circulation, nerves, everything is working fine. Podiatrists can also write scripts for special shoes or inserts. They will want you to see an optometrist because diabetes can damage the small blood vessels in the backs of your eyes. That can include, and it can also increase your risk for glaucoma. They will also want you to see a diabetes educator. These can teach you how to live with the disease. Also, they can help you design a meal plan that would work for you. If your diabetes is uncontrollable, your family practitioner may recommend that you see a specialist, which is called an endocrinologist. For learning more about your diabetes, having support groups, you can always check your local hospital. They will have support groups. Usually they are free. You can also always go to the American Diabetes Association website. They will have questions and answers. They will give you information on support groups. They can help you with meal planning, and they can help you with any other questions that you may have regarding the disease.